Welcome to the PowerPoint presentation of Team 4. And here are the members of the team. And here is the case scenario of Miss Anna, a 31-year-old mother who just immigrated to Canada 6 months ago. She fled her country where she feared for her life due to her ethnic background. Now she lives in one-bedroom apartment in the Marlborough neighborhood in Toronto. Anna has 2 children aged 5 and 2 years. She's not working at the moment, and she's receiving support from Ontario Works for food, housing, and other living costs. Her PTSD is caused by many problems, both in the past and present. Anna had lost everything back home, including her family, her friends, and her work, due to the political violence and chaos. Her partner in Canada was physically abusive to her, and he was cheating on her with another woman. Eventually, she left him, and now she lives alone with her young children. Anna recently found out that she has contracted HIV and worries about her future and the future of her children. Here are the barriers to care. Anna suffers from severe PTSD symptoms, where she has flashbacks of the trauma of her experience back home. However, she's resistant to openly talk about it. Anna's shame about having HIV prevents her from seeking proper health care. And since she lives in a big city, the healthcare services are overwhelmed and understaffed. In addition, waiting times are long, and home visits do not occur often enough to properly assess her living situation. And here are the challenges in care. Communication will be difficult due to her unwillingness to talk to strangers, and that could also influence her health, as it will be hard to educate her in terms of her PTSD and HIV symptoms and inform her about treatment and care needed. It will be challenging to get her to accept that she has symptoms of PTSD and that this could cause harm to her children. Another challenging variable would be establishing a trusting nurse-client therapeutic relationship to address her health needs. Due to the problems in the local health services, setting up a program of care which include visits to doctor, psychiatrists, and social workers would be more difficult.
Hi everyone, my name is Manpreet. So next we will discuss about definitions, examples and local statistics as of our case scenario. Definitions include refugee. Refugees are people who have fled their countries because of a well-founded fear of persecution and not able to return home. Refugees are different from immigrants because immigrants can settle down permanently in another country, but refugees have to flee. Next is HIV. HIV stands for human immunodeficiency virus that attacks body's immune system, and if it's not treated then it can lead to AIDS. HIV has 3 stages. Stage 1 is acute stage, stage 2 is chronic stage, stage 3 is AIDS. Next is post-traumatic stress disorder PTSD. As Anna is suffering from PTSD because of some past and present problems, PTSD is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. It's natural to feel afraid after any traumatic situation, but its symptoms usually begin within 3 months, but some develops after a year. That symptoms include avoidance of that event or situation that reminds traumatic experience and bad dreams. Next is local statistics about refugees. In 2018, Canada admitted 8,156 government-assisted refugees, 18,763 privately sponsored refugees, 1,157 blended visa office referred refugees. In 2014, IRB approved 49% of refugees in Canada, and as of 2019, 14.2% refugees accounted for permanent resident in Canada. Refugee status according to country origin in 2019 include India 7,345, Mexico 6,345, Iran 5,620, Nigeria 4,150, Colombia 3,395, Pakistan 2,680, China 2,045, Turkey 2,025, Haiti 1,625, and United States of America 1,500. Thank you.
Hi everyone, this is Penba Dolma and I'll be sharing some of the few points on legislation or subsidies for HIV in Canada. Canadian legislation states that people with HIV have a duty to disclose their status before engaging in sexual acts. HIV people have the rights to be accommodated by their employers as same as people with medical disability. Canada has some of the leading researchers in the world related to HIV, and the main goal of research is to minimize the disease. And one of the old society which help HIV people is the Canadian AIDS Society, which was created in 1986, and the main goal is to enrich the lives of the people and communities living with HIV. The next which I'm moving on will be, which is very important, the universal precautions. It is mainly focuses on the healthcare professionals and workers to proper handling of the sharp items, uses of barriers such as gloves and masks to protect the person handling the blood or body fluids. And then I'll be highlighting two NGOs which help the HIV people in Canada are Canadian AIDS Treatment Information Exchange (CATIE) and Canadian HIV/AIDS Legal Network. Thank you.
Hello guys, my name is Jandeep Berhard and today I'm going to talk about the strategies and resources for Anna. And the refugees have to face many challenges when they come into Canada, such as the loss of social status, unemployment, problem with the language, community isolation, incidents of racism. They might have to suffer with the domestic abuse and discrimination, such as Anna. The available resources for Anna in Malvern area is Malvern Family Resource Center. This resource center helped the new refugees for a resettlement. They have many programs to help the refugees. They also provide the information for healthcare professionals on the services available for kids. There are also crossroad clinics available in Malvern area. I can introduce Anna about the IFHP program, which cover the health cost for refugees. I can also get her registered to family doctor, and I can introduce her about the walk-in center in Malvern, where she can go about without any appointment. I will also assess her psychological health, because impact of stigma is very harmful. People with the HIV struggle with the disease, and same time they have to suffer with the embarrassment and stigmatization. According to Canadian Treatment Action Council, you have medication for HIV, but no medication for stigma. Educating us about HIV is the only way to get out of stigma. So Anna need to be educated about the stigmatization. She might need to introduce social groups living with the same disease to get over the stigmatization.
Hello everyone, this is Tenzin Timbe. Today I'm going to present about nursing consideration, an assessment tool related to Anna's scenario, who has HIV and PTSD, which stand for post-traumatic stress disorder. Now, what I have here is a nursing considerations. So it's very important for the nurses to introduce themselves and their role during care, so that patients understand who you are and your role. They feel empowered to be actively engaged in their own care. It's very vital for the nurses to know the economics of the medication the client is taking in order to prevent drug interactions. It's also vital for the nurses to know if client understand the symptom of HIV, symptom of PTSD, and need for continuous care. Providing calm and reassuring environment. Primary PTSD are often fearful, so providing calm environment can lessen the anxiety and promote a feeling of safety. What I have here is a nursing consideration for risks for suicidal and homicidal ideation related to PTSD. Recognizing the significance of social determinant of health in context of HIV and PTSD. Understanding the client support system. It's very important for us to understand and respect clients' culture, clients' belief, religions, value in order to provide culturally competent and safe nursing care, and provide education and information to patient and to the family and to the community as a whole. Second part I have here is assessment tool, and the first thing I have the assessment tool is physical examination. It's assessing the skin integrity related to manifestation of HIV infections, assessing the respiratory for shortness of breath, cough, adventitious sound, and for the gastrointestinal and bowel sound, bowel movement, color consistency, pain, nausea, vomiting, weight gain, abdominal pain, etc. And PQRST tools to evaluate pain, which P stand for what promotes pain, Q quality and quantity of pain, R radiation or regional symptoms, S severity of pain, and T time of how long they have symptoms. And reviewing laboratory studies to accurately diagnose the illness, and to assess the current trauma-related symptoms through questionnaire and or behavior observations. Assessing clients' vital signs. Second, using DSM-5 published by the American Psychiatric Association and PTSD checklist in order to assess clients' mental stabilities. The Columbia Suicidal Severity Rating Scale and PHQ-9 Depression Scale. This depression scale is one of the most validated tools in mental health and help clinicians with diagnosing depression and monitoring treatment response in relation to PTSD. All this information collected from the assessment tool can be used to compile a profile that provides a big picture view of clients' mental and behavioral health. Thank you. Using DSM-5 published by the American.
Hello, my name is Shraddha Baksh, and today I'm going to talk about resources and external partners that might be helpful in Anna's situation. A recap of Anna's situation first. Anna and her children recently arrived in Canada 6 months ago. She has refugee status here in Canada, and she is in desperate need of help. The psychological and social stresses from extreme loss and grief are often experienced by refugees, and this is apparent in Anna's situation, where she suffers from severe PTSD symptoms that has a consequential impact on her day-to-day activities. As a community health nurse, I would assess the factors that might influence Anna's health and that of her children's. I would connect her to CCR, which is the Canadian Council for Refugees. It's an umbrella organization, and it addresses a wide range of concerns, including integration of immigrants and refugees, refugee resettlement, newcomers' access to services, and rights of children. As Anna has newly been diagnosed with being HIV positive, I would connect her to the HIV support groups in the community, such as the ACT organization in Toronto. ACT organization has grown to be one of the leading organizations that coordinates HIV support groups. It helps with confidential counseling at a location of patient's choice. It supports the individuals with employment and finances, and it helps with career solutions, housing support, social support network, and also offers social support programs for women living with HIV. Furthermore, in regards to Anna's PTSD symptoms, I would assist her in making informed decisions while choosing the treatment programs available in the city. I would connect her to the Canadian Mental Health Association in Toronto that provides services such as case management services. Case management services provides help in dealing with PTSD and other mental health issues. It works with individuals who need support with their day-to-day activities such as banking, medical appointments, and budgeting, and it promotes independence and a better quality of life. Another program that is offered is through Assertive community treatment teams, which provides intensive support services for individuals suffering from mental illness, the ones who have complex needs, and where they find it challenging to engage with other healthcare services. Strengthening Community in Scarborough is another such program, which is offered to individuals coping with stress, depression, and other mental health issues. It offers a variety of services such as chronic disease management, housing support, family support, skills development, and goal planning, and connections to other resources in the community. Thank you.
Hello everyone, and this is Sushma, and I'll be talking about how can we build a trusting relationship with our client. And as we already know that our client is HIV positive, so first we need to understand that trust is the main aspect of the nurse-patient relationship, as the nurse is the person who works closely with the patients rather than the other healthcare provider. And if a patient is unable to develop trust with the nurse, then they won't share much information. Less information will be shared, which will eventually lead to the decrease in the quality of care they can receive, because we will not be aware about the experience they are having. So we can develop the trusting relationship by following. First is address the client by the client's name or how the client prefers. Second is provide accurate information regarding the care and always respect client decision regarding the care. Third, we need to approach the client with a positive attitude and show the non-judgmental behavior so that they can freely express themselves with all the emotions they have. So fourth one is observe for non-verbal clues of the client and maintain the confidentiality of the client. Fifth is provide empathetic care to client, and sixth is keep your words and be transparent to care provided. As our client is living with AIDS, to develop trust we must ensure to provide accurate information with non-judgmental attitudes, and we will provide the client with the different activities that help her for the social development, such as encouraging her to participate in the social gatherings, social discussions, and then increasing awareness and educational program regarding the proper management of the health conditions or the disease. And we should always remember that trust is the fact that makes us close to the patients, and trust helps the patient to share the experience, leading to the better treatment and increased quality of care.